Hi guys, this is John Adamson, the rehab and documentation guru, and today I'm going to talk about cardiac measures, more specifically using heart rate to determine the efficacy of what you're doing with your patient, as well as training ranges that you can work on with your patient. This can be used by any discipline, so it's not just part of the scope of practice of just PT or OT or speech, but all three could easily use it. And so let's talk about heart rate and why it's important to look at it. First of all, a little story. When I was a clinical supervisor and a multi-site director of rehab, I had one of my therapists under me. I did an evaluation, and part of my goals was using heart rate to determine the safety of a patient doing a functional activity. And I received word that this therapist was not happy with it, saying, "I'm not a nurse. Why should I be looking at that?" Now, I think most everybody that watches this channel would say, well, it's pretty obvious why we should be watching that. But a lot of therapists don't feel comfortable in using heart rate as a parameter. And so what I'm going to say is not rocket science. Many of you will remember it from the day called school. And so let's just go back for a moment and talk about what heart rate signifies. It signifies a lot of things that are going on physiologically. And as we know, when we exercise, there are byproducts of that. Normal metabolism at rest is going to be accelerated when we exercise. And just like normal metabolism produces waste products, when we exercise, we just produce waste products more quickly. And we got to get rid of those because then it impacts our homeostasis, that equilibrium that our body needs for its chemical balance and its acid-base balance. So when you exercise, your heart rate going up is part of not only getting nutrition to the cells, but also removing waste products more quickly and efficiently. So we have to keep that in mind when we're looking at heart rate. So we learned back in the day called school that normally we will be resting at a heart rate that's fairly on the lower side. Normal heart rate is 60 to 100 beats per minute. Once you're getting above 100, you're considered tachycardic. Once you're below 60, you are bradycardic. Now, being bradycardic is not a problem if you're an elite athlete or a relatively fit individual. You may have a resting heart rate in the 50s, some people even in the 40s, and some real elite athletes go even below that. But for the most part, we're not dealing with elite athletes. And if you're above 100, there could be a lot of things going on from a health perspective, but you would be considered tachycardic, meaning your heart's working too hard just to be at rest. And then you learn back in the day called school that there's a basic formula to take. Your 220 minus your age would yield you a rough estimate, and I say rough because it's individualized, what your maximum heart rate should be. So I'm 50 years old. So 220 minus my age, my max heart rate technically should be 170 beats per minute. That should be the upper range of what my heart is capable of on average. Now, we know we don't work out at 100% of our predicted max. And in general, and this is just a general guideline because there's some variation in this scale, we should be keeping between 60 to 80% of our predicted max to determine that we are in what's called aerobic range, meaning that we can use the oxygen we're taking in to help us get rid of the waste products and, of course, produce energy. I mean, that's the most important thing. We're producing energy aerobically, but we also have the capability of keeping up with the waste product removal. Once you go above 80% for most individuals, you start entering to anaerobic metabolism. And then therefore, you get to a point where oxygen is no longer sufficient for you to maintain your metabolism, to keep up with your energy demand. So you start utilizing other pathways. So when you use those other pathways, as you might remember, one of the byproducts is going to be increasing acid levels within your body. Now, your body has to maintain a very fine homeostasis for acid-base balance. If I remember right, it's like 7.25 to 7.35. Somebody can correct me on that, please. And so as soon as you become more acid, closer to that 7, your body really has to get rid of that, because you can cause all sorts of problems, because you've entered into metabolic acidosis. So anyway, you want to keep that to that 60 to 80% of the predicted max heart rate to train an individual, or even doing functional activities. You would not expect a patient to get to 85% of their predicted max getting dressed. That's going to be too excessive a heart rate response. So we know they have a cardiovascular limitation. They probably even have a lot of weakness because their muscles are working much to produce effort for that activity. Now, there's a more specific tool than just the 220 minus your age. And I know I've kind of talked on this in a previous video, but that's called the Karvonen, Karvonen formula. This is a more specific and more sensitive tool to use to determine patients' training rate. And so what you do is you take 220 minus their age, and then you take into account their resting heart rate compared to their max predicted, and then you do the formula. Anyway, there's apps for the Karvonen formula. You can look it up on Google, and it's a more sensitive tool to determine training rate than just doing 220 minus the age times 0.6 to 0.8. So anyway, with that in mind, we do have to keep in mind that there's a huge swath of our population, especially if you work with geriatrics, that a Karvonen formula or a predicted max heart rate formula is not going to work very well, because there are a lot of cardiac meds and other types of meds that alter heart rate response and make it ineffective to determine whether or not somebody is working at optimal level. And when I talked about RPE, rate of perceived exertion, recently, I mentioned how going from heart rate response to looking at RPE response might be a good way to utilize cardiopulmonary performance for patients that they have medications that are altering their response, or maybe like an older pacemaker. But most newer pacemakers do adjust for heart rate needs as patients' performance needs increase, I should say. So anyway, this has been John Adamson, the Rehab and Documentation Guru, reminding you that heart rate is a very important thing we should be looking at, and how to calculate very basically where the patient should be in terms of exercise response and, of course, functional activity response that PTs, OTs, and speech therapists can utilize to better determine that what they are doing for their patient is safe and effective. Anyway, take care. God bless. Have a great day. Please like and subscribe and leave any comments that you have.